holidays. If you're going to plan it around the holidays, do it way in advance. If you have a week off for recovery,
you can have somebody that 2 different people Wednesday go back to work on Monday, as long as you're off of all your pain medications.
True.
Like no driving until you're off of that.
Yeah.
Oh, I want a beauty that will give me that glow. The kind of body that'll make them say, whoa. Get it right with the knife who slays. Beauty and the blade. Yeah. Get it right with the knife who slays. Beauty and the blade. Get it right with the knife who slays. Beauty and the blade.
Good morning, everyone. Welcome to Beauty and the Blade, where beauty begins on Go Country 105. I'm Ashlee Park, alongside with my wonderful husband, Dr. Park.
This particular episode, we're going to just kind of smash it everywhere, and we're going to talk about heroes and holidays. Before we do that, let's talk a little bit about a myth buster that you heard, honey.
Okay, you ready for this one?
I'm ready.
Because this is a question that a lot of patients ask, friends of mine ask, family. Mm-hmm. So does liposuction get rid of cellulite?
That's a really, really good question. It's a very important question because I do get that in my clinic very, very often. Mm-hmm. I will say this, whoever invents the cure or treatment for cellulite will be like a billionaire, right, and like Nobel Prize winner or something like that, because currently in our armamentarium, we do not have treatment for cellulite. There are machines out there, Selfina is one of them, that kind of goes underneath and tries to heat it, but we do not have a real cure for cellulite yet. The reason why is because if we look at the dimpling, what's actually happening is the skin has fibers that are going deep into the fat. So what really needs to be done is to literally break up every single fiber there. I do use a power-assisted liposuction device that can go underneath and kind of break up some of it, but it's not a cure-all for cellulite. So,
do you feel that a patient or somebody that has cellulite, is that kind of genetics? I mean, I've seen where there can be this skinny person and they have cellulite.
Yeah. I think there's an element of genetics involved in it, but I mean, it's kind of like scarring. When people scar and have keloids, you can't predict it, and there is an element of genetic component to it. It's a very, very challenging problem. I will tell you this, if you go in for a consultation, thighs are very common to have cellulite and dimpling. Right. And if someone says, hey, I have a cure for that or I can treat that, I would say really, really think hard about that, because I will tell you, if you have cellular on the thighs, I will not do liposuction because of the risk of making it worse. Okay. So you've got to be super careful.
Okay, so we have our answer. Liposuction, getting rid of cellulite, myth.
No.
It's a myth.
It's a myth. It is a myth. Let's get into the holidays.
Okay.
Talk about
holidays with the Parks.
Holidays with the Parks.
Oh boy, what's your favorite holiday of the year?
Wow, there's so many. Christmas, obviously. Yeah. Easter, for what they kind of represent. Yeah. You know, Christ being born, Christ being resurrected.
When you were growing up, for instance, like Easter, did you guys celebrate Easter, or was it just certain holidays you guys? Not
as much as you, honey. I mean, you literally have every single holiday as like gifts to the kids. And I like it. I think you're able to just spoil our kids a lot.
I'm just a giver.
You're just such a giver. But I mean, for us, Easter was like go to church. Christmas is going to church.
Did your mom did the Easter Bunny do baskets?
No, Easter Bunny never showed up. Nope, not at my place.
Did you find eggs or anything?
Maybe one.
Yeah.
You know, it wasn't a big deal from a celebration standpoint, but I do remember obviously going to church for Easter, Christmas. Those were, good family moments.
So when I took you to my family's Easter party at the park, do you remember that? Were you like, what in the world?
Yeah, there was a lot of celebrating going
on. And the adults would hide eggs and make a little fun game. And
I think all of these holidays, what's super cool, like your family and you with our kids, I mean, you've definitely taken it to a different level. But I think it's just literally what I like about holidays is just creating memories.
Right.
And you've done such a good job with our kids
Thank
and
you.
whatnot. I mean, they just get presents and chocolate and they get sugar high. I mean, it's
Chocolate.
insane. But
I think it's because you always want to eat it.
yeah, I do eat it. I steal their chocolate every once in a while.
So for Christmas, how would you be your Christmas at home?
Christmas at home for me was, pretty typical. I will tell you this. The thing about holidays I think everyone enjoys is its time off,
Right.
And I'm going to segue a little bit into plastic surgery and what we see in our practice, which is it is one of, you see me, my busiest times is Christmas.
Right.
I used to not take vacation, as you know, because everyone wants to heal over the holidays. We have teachers, we have other people that get 1 week off. Thanksgiving is the other one, huge holidays. So if you're planning your surgery, I would say certainly if you're going to plan it around the holidays, do it way in advance because we just get
really busy,
inundated
yeah.
with it and people want to. I think it is a good idea because if you have a week off for recovery, that is a good time to do it. And often people have it over Thanksgiving. In terms of recovery, just a little bit about kind of breast augmentation or breast surgery. I call it more of like a weekend recovery, about 3 to 5 days. Oftentimes I'll operate on a Wednesday and then they'll get back to work Monday. Would you say that's a pretty...
I think it really depends on their job. Like if you have
True.
a desk job, you don't know really what it's like
Yeah,
to go under. Have you had any surgery?
I don't have implants yet. And I don't plan to, but no surgeries for
So
me.
it's like, that recovery, it depends patient to patient.
Yeah.
And you can have somebody that 2 different people, men, women, whichever, and they both work a desk job.
Right.
But sometimes it takes a little bit longer for somebody else to recover.
What would you say to get back implant surgery for a desk job? How many days? Like 5 to 7?
I would say about 5. Like how you were saying Wednesday, go back to work on Monday.
Right.
Yes. But as long as you're off of all your pain medications,
True.
like no driving until you're off of that.
Yeah.
You have to, I always tell patients, if a car was coming at you, are you able to because you feel
That's a good
tight,
point.
your muscles feel super tight. So are you
a good
able to
point.
jerk that steering wheel out of the way?
Yeah, you don't want to herky jerky on them.
Yeah,
That's gonna hurt.
you can't
That's
move.
gonna hurt.
You feel a little. And what's really important too for patients to know after recovery, I have been there where it's like, I'm in pain. I don't want to move. I
Yeah.
have my body all propped up. You have to get that range of motion and
Right.
get some movement because if you're stiff, it's
then
going to
you
be
get
a tough.
stiffer.
Yeah,
And
you get stiffer.
you do. And
Yeah.
that's a very important point I kind of want to shout out on recovery. About 10, 20 years ago, you're right. People were bandaged up and they didn't move. They stayed in
Yeah.
bed. For a breast surgery, I will tell you, and it's a first time under the muscle, the very first thing, and I actually quiz my patients as I'm marking them in surgery. I say, what's the first thing you're going to do when you get home? And the answer is stretch. You need to move. The analogy is as if you've done 1,000 push-ups. When you work out, you're tight, the muscles are contracted. What do we do after we work out? We stretch.
Right.
So we want to have big range of motion. I tell my patients to stretch every hour immediately after implant surgery. So this kind of, instructions changed a little bit.
Yeah.
But that's what's going to help you heal quicker and get back to your routine. So
And walking.
And walking, yeah.
Any surgery, you want to get that circulation
Exactly.
moving. Don't stay in the same position because of, you start to get stiff, but
Right.
we also want you to get that circulation, get that blood flowing.
Yeah, because for example, if we talk about now moving into a little bit of a bigger surgery like tummy tucks, right? And when I do my contoured abdominoplasty, you're going to need at least a week off, right? I mean, 1 to 2 weeks off work, maybe a
I
little
think
bit
maybe
longer.
2.
Okay, 2 is being, we have Frances over here who came back to work in a week, but it is a range. She's a tough
She
cookie.
has a very high pain tolerance.
If you know her, she's very energetic.
Yes.
But the main thing about tummy tucks, and you touched on a very, very important point, we want you moving and circulating because one of the number one recovery complications is a DVT or a PE.
Yeah.
What that is, it's clots in the legs. We've kind of heard about in COVID as well. If you have clots in the legs or clots in the lungs, it's because you're not moving and circulating. So
What would
once
be a sign
again,
of that?
a very good point. So in tummy tucks, if they're kind of laying down and they're not moving, we ask our patients in the first 5 days, hey, if you have any calf pain or any swelling, that's an immediately sign for me to say, hey, we need to get an ultrasound of your leg to rule out any clots in the leg. So that's really, really important. As far as clots in the lungs, we want to think about, hey, if you have any shortness of breath, that's a big, big sign. And again, we want to, those are emergent things where you want to go to the hospital and get scanned to make sure we don't have
Right.
any
And
of
it's
that.
very important not to ignore those signs, because
Right.
sometimes in our house, I'm like, if you're able to breathe, you're not bleeding out, you're good. We don't need to go to the hospital.
Yeah.
But if you have any signs of that, I think it's very important. You just head to the hospital, have them check you out, make sure everything's okay, just to rule it out.
Right.
So you don't have that concern and worry.
One of our core values is communication.
Right.
And I actually am super proud and just about our staff. Again, Frances is behind me, big supporter. She gets calls constantly from patients, and there is no wrong question. If there's any little question, I'll tell you, she has even diagnosed breathing issues of, hey, Dr. Park, this patient is going to the hospital, needs to just check out her lungs to make sure that she's breathing okay. We want you guys to know that there's 24/7 communication specifically with one of my coordinators or with myself. And that's so important, especially in that first week. If we're looking for risks and such, that's going to happen in the first 5 to 7
Right.
days. So
Have you seen that happen past 7 days?
very, very, very rarely.
Okay.
We have seen, people with some breathing, maybe like 2 weeks out. It's super rare. But once again, if there's like any issues, it's kind of like, please call us
Yeah.
immediately, and we can kind of triage it out.
Right. Is it different per surgery? How long? I know everybody, after they have surgery, they're like, oh, they weren't even working out before, but they're like, I'm going to go to the gym. So
Yeah.
does it depend per surgery?
Absolutely. Yeah. I would say, we talked about body surgery, which takes a little bit longer. That's probably the most common question. When can I go back to the gym? Everyone's trying to work out, which is
Yeah.
great, except me. I don't work out, but I need to. Little like bump to myself. But as far as like breast surgery, I let my patients go at about 4 weeks. You can hit the gym, lift, start doing, all sorts of things. And then tummy surgery, kind of like a C-section, if you've been given those instructions, it's 6 weeks. 6 weeks, you can hit the gym, run, lift, etc.
Yeah.
Obviously go very slowly into it.
Now I can see why during the holidays, especially Christmas, you get very busy, because there are a lot of, you have teachers, students, a lot of people that they like to take those 2 weeks off and be
Yeah.
with their family, but they get to take those 2 weeks off and
kind of relax.
recover.
Yeah.
Yeah.
So another very, very quick recovery is face. As you know, we've had patients very commonly eyelid lifts, face surgery. Anywhere I'm operating in the face, I tell them 1 week, you're looking golden, right? So some people will again say, well, how much time should I take off? If they want the full week during, say, Christmas or Thanksgiving, that's fine. But I have patients that just, it's really more of a cosmetic recovery. It's not going to limit you, which is kind of nice. Let's say I'm doing eyelid surgery and you're bruised and swollen, but you have shades, go to the market, take care of your errands. Face heals very, very quickly, primarily in about a 1 week window, versus the body, which is about 4 to 6 weeks.
Yeah.
Yeah.
So we were talking about holidays.
Yep.
We talked about how we grew up and how we celebrated holidays.
Yeah.
How do we do it now?
It's
I
funny.
know it's kind of changed a little bit, because for so many years, ever since, we got
Thanksgivings.
married, it was every Thanksgiving, every Christmas,
Yeah.
we would celebrate. Even I think a few Easters, we celebrated
Yeah.
it here at our
Yeah,
house.
commonly.
And now we kind of switch that
Yeah,
up.
I feel like we try to take a little bit of a break. I was talking a little earlier about how I generally don't like to take days off, but I think one of the most important things that we're striving to do in our life now is just kind of deepen our relationships with our family.
Yeah.
So now I force myself December 25th to the 1st. It's like I just cancel out my days at
Right.
clinic and my surgery so that we can go on our break. I feel like we've been taking a lot of vacays during Christmas.
Yeah. I mean, I think that we used to always, because when our children were little, they were all on the same calendar,
Yeah.
right? During summer, they would all be off at the same time.
Yeah.
Now we have a child in high school and then
Yeah.
one in middle, or two in middle school and one in elementary, to where they have different calendars here.
Yeah.
So the only time we used to always summer go to Hawaii, that has kind of changed. Now it's our family trip is during Christmas.
Yeah, Christmas is definitely a 1 week that we treasure for our family. I think that's super important. As far as summertime, I feel like a lot of people go on trips then
Yeah,
have,
and it gets
again,
really
another
crowded.
good time to recover,
Yeah.
I'd say, for plastic surgery.
Yeah.
So I've got a listener email. Do you want me to go ahead and read it?
Here, I'll read it for you. So, listener email. Kathy from Glendale emailed, "My daughter is 16 and needs a nose job. I know that sounds terrible, but it's true. Could she even get the surgery at that age? Thanks to you both."
Ooh, that's a really good question, which touches upon quite a few things. So 16, as you know, you do not have consent
Right.
until you're 18. So if anyone is age 18 or under, we definitely need parental consent. I don't think it's awful, as Mom said, because you know she wants the best for her child. I have done plenty of consultations with 16-year-olds for rhinoplasty. So a couple things about rhinoplasty is, number one, we want to make sure that the patient is both physically and emotionally mature. So age 16 to 17 is when a female kind of bone structures do mature. So I have done a rhinoplasty as young as that. I also converse with both the daughter and the mom or dad just to make sure they're mature enough to handle the recovery and such.
Right.
So we're talking about a pretty big surgery that goes, you know, it's the center of the face. Obviously the daughter's self-conscious about it, Kathy here. And so I think it's generally okay once I've done the interview and just made sure that the parent is definitely on board. What are your thoughts on rhinoplasty in general?
Well, it's pretty funny. This weekend, a family member of mine has been staying here. My husband kind of slipped about me having my nose done. And I was
I thought
like,
it was coming.
wait, what? Like, I was keeping this from my family. I didn't want them to know, but now you guys are all gonna know. But actually, my mom, I saw her a few months ago, and she was looking at me, and I had no makeup on, and she was like, "Did you do something different with your face?" Because I just grew up with having a wider nose, a bump in the middle.
It was not that
You
bad.
think that, you know what? I will post my before and after on our
I'd love to
website
see
or
that.
Instagram, and you guys will see, because it's such a huge difference. It takes just one person to say something, and
Yeah.
that's something that you will dwell on. Like, you
Yeah.
just pass by in the mirror, and you're just walking by a mirror, and it's like, that's all you see, you know? So I actually waited. I was scared of the recovery.
You actually did some fillers.
Yeah, I did
you know,
for
before
years.
on the
I would,
line.
which is very dangerous. You have to always go to somebody that really knows the anatomy. I would say like 5 years, 6 years, okay, maybe 10. No, how many years before I actually had
years.
my nose done? I would put fillers in there, and to
Did you
even
do it
out.
yourself,
No, I did
or-
not do it
okay,
myself.
okay.
That was the one procedure I did not do on myself.
Yeah.
Other ones I would.
How
But
did they disguise with the filler? I mean, it was a very mild hump.
you think that, but it's like when you
Yeah.
look back at the photos and and also from getting into a fight, I broke my nose. So
Okay, let's
yeah,
hear
I
about that
know.
later.
So up on the bridge, we would add filler and then onto the tip, and so it
Correct.
would just kind of even out that
Correct.
hump.
Yeah.
But yeah, so I had my nose done, and It's amazing. I will say, like, I've talked about my breast in the past, and like that was something that sticks with you. But look at me now. No. But
Queen,
yeah, but
angel.
having my nose done, that, you know, you could be fully clothed and you can hide your body, right? But your face, I guess you can walk around with a face mask, but
COVID
yeah, but just
protection.
having my nose done was life changing. If that's something that your daughter is struggling with and you go and see Dr. Park and he agrees with having that surgery, I'm 100% on it.
Tell us a little bit about recovery with the rhinoplasty. How did you do with that? I think you did pretty well from what I remember.
I actually, that's, at the same time when I had my nose done, I had my lower lids lasered. So at that time of healing, everything was really swollen. I told myself, okay, I'm gonna, you know, for a week, I'm not gonna look at my phone. If I am able to read, I'll read. I just need to find that self, because that was in COVID time. And as I've spoke about before, it's like I suffer from really heavy anxiety and OCD. So when I was able just to sit there with my own thoughts, I don't know, I just feel like life in general is very chaotic. And so just to sit there and have my own, like, I felt like I went to some health retreat. You know, it was amazing. I had no pain. I didn't take any pain medication. I was scared having the post-nasal drip.
Did you have any of that a little bit?
A little bit, but not bad at all.
Congestion?
Not really. Not really.
You must have had a great surgeon.
I know.
I'm just saying,
no, it was really a smooth and self-healing time.
No, I love that about you, and I remember that. Obviously, I'm right by your side when you're healing. And the first thing I would say is rhinoplasty in general is exactly as she said, almost zero pain. Despite me remodeling bone, the three areas that I'm looking at and most commonly in a rhinoplasty is, as you mentioned, there's usually a little bit of a hump here. We're talking about a little bit of width in the nose here. And so that bone needs to be remodeled, and then a little bit of tip reshaping in the tip. So we did go through those steps, but like you said, minimal pain. You do wear a splint for about a week, okay? So people do hide out for that, unless it's like Clueless, the movie, they're wearing their splints. But once the splint is removed, again, you're off to have a nice dinner. It's very quick. Everything in the face heals very quickly.
Yeah, I actually went back to seeing patients on day 7.
Yeah.
And of course, like, I was red from the laser, and I didn't get too bad of bruising, but I had some bruising, but I'm like, it's all right.
Cover up.
I work for a plastic surgeon. This is normal.
It was good marketing.
It's a conversation starter.
Conversation starter. No, you did absolutely awesome. And it's one of my favorite procedures. Rhinoplasty, it's the center of the face like you talked about. It really, really does. I see a lot of people just change their lives, and their confidence and esteem is just because it's right in the middle of the face. I mean, people are really, really can be self-conscious, but I think the results can be super, super rewarding.
Yeah.
I love that.
No, it is. I always say that was like a life-changing.
Speaking of rewarding, let's dovetail a little bit into heroes or people that have inspired you. Do you have any heroes or someone that has really made a impact in your life?
Yeah, I would say when you're asking me that question, the first person that comes to mind, I would say my grandmother.
I thought you were going to say me. But,
okay.
Grandma in Tucson. I love her. As far as my heroes, obviously, you know, Jesus Christ is like my largest hero and motivator, and everything I do, all glory to him. But if we're talking about people, I mean, literally everyone is a hero to me. Obviously, like your grandma, the people that have made the most impact, my mom, my dad, right, in terms of, you know, making me who I am. But as far as like literally what I try to do with my patients too, one of my biggest heroes and inspirations are my breast cancer patients, because, you know, when they come to me during a consultation and the fear, the trepidation, and just what they need to go through, the struggles, It's truly, truly awe-inspiring. And the nice thing about breast cancer, fortunately, it's got a very, very high cure rate. So I often will combine my reconstruction of the breast cancer patient with the mastectomy, the general surgeon. So it's a combined procedure. That way they wake up with implants already in place. And I think one of the devastating things back in the old days when they did delayed mastectomy reconstruction is they would wake up flat. And they often just, portray about that emptiness and that the wholeness being gone. But as I walk through this journey, and I really feel it's kind of just like a gift and a privilege to watch them heal and ultimately restore the wholeness of their breast. That is a huge, huge thing. I mean, the fact that they're also able to conquer cancer.
Yeah, and I love the fact that they start this community. I mean, I remember we had a couple patients that they were a little nervous about having their bilateral mastectomy, and it's for us to have a community that stays strong within that. And it's like, oh, you know what? You're not going through this alone. Like, you can contact this group.
Yeah.
And
the thing about when you go through cancer, and I just see this through them, is they're just so absolutely giving and generous. And a lot of my patients will say, hey, I'm cured, and here, Dr. Park, just take my number. And if there's a future patient that's going through this, have them call me.
Right.
And that community and that generosity to share that struggle, because the amount of emotional support, I can't even give them that support that other patients that have gone through it.
right.
And those patients are they're like my heroes. I'm just like, oh my goodness, thank you for sharing your story with this new patient, because I can't even imagine, going through
And
it.
not that everybody else isn't like our hero or lights us up of our patients, but I would say, like, I agree with you. It's the breast cancer patients. I can always remember them.
Right.
Like, I'm really bad with names now that I'm getting older. It's so crazy. It's like those patients have really like impacted our lives.
Yeah. It's just the amount of the struggle that they go through just transforms their perspective. They're often just in deep gratitude, super humble. And what it does is it kind of just makes me look at myself and be
Right.
like, hey, I just need to be a little more thankful and,
Right.
for my health, for my children, for my beautiful wife. It's just been a blessing.
We're coming to the end of our show, but it was great chatting with you guys today. We'll see you next time here on Go Country 105. Beauty in the Blade, where beauty begins.